Welcome everybody. Perhaps we could introduce the people that are here for the people online to realise who's in the room. Hayley, do you want to start?
Yeah, good afternoon everyone. My name is Hayley Gwilym. I'm a Councillor, Cabinet Member for Community Support Services.
Councillor Louise Gibbard, Cabinet Member for Care Services.
Randall, good afternoon. Amy Hawkins, Head of Adult Services and Tackling Poverty.
Good afternoon, Rachel King-Thomas, Quality and Improvement Officer.
Good afternoon, I'm Sue Evans and I'm the Deputy Regional Director for Llais, Swansea Bay and East Port Talbot region.
Councillor Sue Jones, Chair of this meeting.
Liz Jordan, Scrutiny Officer.
Dave Howes, Director of Social Services.
Thank you. Item 1, apologies for absence, Liz.
We've received apologies from Councillor Michael Locke, Jeff Jones, Cheryl Philpott, Alison Anthony and Officer Helen St John, Chair.
Thank you. Any other apologies? No. Okay, disclosures of persons and prejudices. I can never say this. Prejudicial interest. Are there any? No, lovely, thank you. And item 3, prohibition of whips, votes and declaration of party whips. And we go on to item 4, minutes of the previous meeting. That was on the 20th of March. I hope you've had a chance to read them. Can I say there's a true record? Have somebody to pass it? Thank you, Tony. Thank you. I'll second it. Okay, and the letters for Louise Gibbard, 30th of January, letter to Hayley Gwilym on the 30th of January, and response from the Cabinet Member Hayley Gwilym on the 30th of January meeting. Okay. You've all had a chance to read them. Is there any comments? Okie dokie. Are there any public questions, Liz? None? Okay, item 6, the presentation. Over to you, Sue. It was, wasn't it?
Hello everyone, thank you for inviting me here today. I'm Sue Evans and I am the Deputy Regional Director for what is now known as Llais for Swansea Bay and East Port Talbot region. I've given you the slides in the pack. Hopefully you've all got them. Firstly, I've been with what was the CHC's Community Health Councils for 20 years now. I know quite a few of the members because a lot of the councillors have sat on Community Health Councils over the years. There's been a lot of change since I started as Swansea CHC to then become ABM CHC and now Swansea Bay, Llais, East Port Talbot region. So who are we? We are the independent, trustworthy and inclusive statutory body set up by Welsh Government. We came into being on the 1st of April 2023. Took a while getting there because of COVID, knocked us back 2 years. So we would have been in situ a little while earlier. When we were community health councils, we the watchdog for health. But as we've become Llais, we are now the watchdog for health and social care. So I'm hoping to be able to work with this committee as we go forward to see how we can set ourselves up to work. The third slide shows you our chief exec, our chair, deputy chair and the members of our board. Alison Thomas came over from CHCs and Medwyn was put in post about a year or so before we actually came into being. So on to the next slide. So we're led by our chief exec, Alison Thomas. She leads the senior management team. We are made up now of 2 strategic directors. We've got one for corporate services and one for organisational strategy and engagement. We've got a director of operations. We've got 7 regional directors. We've got a director of people, wellbeing and organisational development, director of governance and finance, and a director of communications and engagement. They all sit under, put my teeth back in our national team. And we then have our local areas, which I'm part of. So we are a small team for this area. When we were community health councils, we had members and we reported to our members. As Llais, we've got volunteers. We haven't got many. We've got very few at the moment. We had a couple of our members came over from CHC land with us. But at the moment now we have, I think we've got about 11 to help us do the work that we need to do. So we look at, we ask them to go out and do visits to hospitals, GP surgeries, social care services. They can volunteer to maybe look at our internet to see what's going on in health and social care. They don't have to be as inclusive as they were when they were CHC. They can choose to be one or the other, or all of them if they want to be. This month, there is a big recruitment campaign going out to look for volunteers. As we said, we are low, but we're low all across Wales. So hopefully, within the next week or so, there'll be a national campaign going out. So the areas that we work under are engagement, where we gather people's views. So we work with people in the community, we sit on representative groups. We, at the moment, sit on more of the health side of things, but I think that's because that's what we know. And moving forward, we're hoping to be able to sit with more social care groups. Making representation is a big change to what we did in community health councils. We don't make decisions, we represent the people, giving their views to whatever change has happened. So if it's a service change, we will gather views from the public and we will pass over our representation. There's one in this area at the moment, Brunswick Surgery. They've been looking to move Brunswick. They talked about going up to, is it High Court or Highfield, which was up a hill, sort of like that, or down a hill like that. And we managed to say, you know, we've got them to say no. It's just not patient friendly. You can't expect people to either walk up, or they thought they could walk down and then walk down to catch a bus. But so they're looking now with the health board at new venue. So that'll be out to engagement over the next couple of weeks. So fingers crossed that one is more patient friendly than the first one they brought up. One of the biggest core areas of our activity is our complaints advocacy service. We've had complaints advocacy since CHCs. CHCs were around from 1974. I think the advocacy started in 2004. So they've been with us for quite a while. They are there to help anyone who wants to make a complaint. They'll guide them throughout for both health and social care as far as it, it turning legal. Once it turns legal, they have to step aside, but they'll take the complaint for them through to the Ombudsman if needed. They write the letters for them, but it's not our advocate's complaint, it is the client's complaint. They're a very busy team. So what does this mean for our NHS and social care partners? So that the NHS bodies and local authorities are under a duty to promote our activities, making sure people are aware of our services. Unfortunately, it's taken us a very long time to get any literature to be able to share with any of our partners, to be able to get our name out there. But we've just started getting them, and I've got leaflets here which will be left for you today for those who can't or want in the building with us. NHS bodies and local authorities must make arrangements to cooperate in the exercise of our functions, so which means including shared information when we ask. We've already worked with Swansea area because we did a big piece of work on dementia services, and we worked with the well, Rachel has been a great help to us all the way. If I need something, I turn to Rachel. But yeah, we went visited a couple of care homes where they had dementia patients. So we had the view of the social care side of it as well as the health side of it for our reports. We've been looking at carers. That was our next big project. And again, we were working with our colleagues. When we first came into being, we set up a workshop where we invited health, social care from Swansea, social care from Neath Port Talbot, and the RPB. So we've all worked together to put together a document that we use for service change. That's been adopted. So any service change now that comes through can come through to us on this pro forma. How do we work? How we work with people and make decisions. Accessibility and inclusion. So we're ensuring the views and the needs of the diverse population of Wales are represented and no one is excluded. We've got our independence. So we're acting on behalf of people of Wales, and we collaborate in and partnership work with the public, health service and social care sectors, as well as voluntary and community sectors. So over to our region, Neath Port Talbot and Swansea. These boxes give you an indication of the types of things that we are undertaking. So we'll make representation. If someone comes to us, complains about a GP surgery, but they don't want to make a complaint, if it's the same thing, they can't get access, and it's the same surgery we're hearing all the time, we will make representation. You know, that's just one of the main things that we make representation for. So we've got relationships now building up with our stakeholders, Swansea Bay Health Board, City and County of Swansea, Neath Port Talbot Council, third sector. We work on a local, regional and national level. So we've, if you look on our website, it's a national website with each of the individual areas broken down, and all our reporting, the dementia report will be on there, the carers report will be going on there soon. Any visits we make to any health services, social care services, they will go on as well. Any actions that we get back from our representations will go on. We will ask that we can receive them in Welsh as well, because otherwise we can't put it on the website. Our team is made up of about 12 people. We've got a lot of part-time staff, so it's a very small cohort. So it's our regional director, myself, small governance team, our advocacy team. We've got 3 advocates, 2 full-time, 1 part-time, and they are support officers. And then we've got our engagement team. So our engagement team consists of an engagement officer and 2 support. Unfortunately, our engagement officer is off on long-term sick, so we are struggling to get out there and engage as much as we can. but we've put out priorities together for 2024-25, and we will be looking at dementia care again. Excuse me, my voice is going. Dementia care again, because when we looked at it last year, we didn't get any response from the Black and ethnic communities. So we want to dig a little bit deeper just to find out whether or not they've maybe, do they use services or do they look after their own? How, you know, how do they, why weren't they coming forward? So we want to dig that a little bit deeper. We're also looking at children and young people, mental health services. That will be later on in the year. The big one at the moment, though, it will be maternity. So we're looking at mother and baby as a overall. At the moment, Swansea Bay has is undertaking an independent review on maternity services. So we have put out a survey ourselves asking for feedback on the terms of reference that are out from the independent panel. Once that comes back and once that's agreed and the review starts, we will work hopefully with the engagement lead for the review to collect as much information as we can. We will also have our own report at the end of it. So that's what we're looking at in our area, but we will have, there's just been dental, there's pharmacy, and there's a couple of other things coming from national that we'll have to fit in as well. Sorry, that's my Welsh slide. And what we'd like you to do, raise awareness of who we are. So thank you again today for inviting me here, because it's been a very slow start, but I think it's beginning to people are beginning to see who we are now, especially those that use our advocacy service. It's getting really busy. We held a national conversation in Cardiff week before last. That raised a lot of awareness, but we need to be raising awareness more for our area now as well. So we want you to work with us to develop ways of working between this committee for a start, and see what you can do for us and what we can do for you. So the contact details are on the last slide. As I say, there's leaflets here as well, which will be left for you. So any questions? Excuse me for my voice, it is going, I'm going to have a drink.
Are there any questions? Tony?
Oh. I did warn you. I'll switch that on. Is that? Yeah, okay. No, I also get how these things work. Very interesting. And of course, I remember the days of the community health councils. I think George Plunkett was the secretary of the community health councils then, way back. A couple of you might call theoretical questions. One is, do you go out looking for trouble or do you wait for it to come to you? And if it's the first, what would be the signals that would cause you to wonder about the organisation, looking for signs of distress or elsewhere? And you mentioned obstetric services, I think. The obstetric service across the United Kingdom at the minute seems to be getting a fair bashing in terms of its quality and the difficulties of it. Some time ago now, there was something called the CPOD report in Swansea. Have you come across it? It should be in the archives. It's CPOD because it was the confidential inquiry into perinatal and obstetric deaths in what was then the West Glamorgan Health Authority area. And I know because I was the chief executive of that health authority. And it was very interesting to see the way that the paediatricians and the obstetricians and the midwives, I wouldn't say they fought for the territory, but I think they each felt that they needed to further establish their position in the delivery of hopefully good quality services to mums and mums to be, but to recognise when difficulties were emerging in a late pregnancy or whatever. So you might want to dig that out and look at some of these. And I'll stop there because I can go on till about next Tuesday on.
Okay, I'll start with your first question. Do I go out looking for trouble? Myself, I think I probably do, because when I go out to events, I will talk to everyone and listen to everyone and just gather as much information as I can. Same with my team. You know, we want to know what's going on out there. We want the feedback. At the moment, we are working with families within for the maternity review. These families are what's the word? They've not had the best treatment services, and they've come to us as a spokesperson really to try and get their views over again, because you know they have tried to do it themselves. So yeah, we will be working with them, and you know it's not going to be easy because some of these children have been really affected by the births and things. So it's yeah, it's going to be so I say yeah, we do go looking for trouble because we want to know what's going on out there.
Back on that point, so in the event that some unease was discovered, particularly among the professionals, and I hinted at the consultants and the midwives, would you regard it as part of your duties to assist with some kind of mitigation and negotiation between the professionals to work out why they're falling out and why the difficulties are emerging from that as a result? Or would your role be limited to trying to encourage the different professionals to come together and do things properly for once, rather than shouting at one another and walking off the job?
I'd say our role is more to encourage. So we would give representation as to how we feel things should be working. But we can refer to Welsh Government. What we normally do is we work with HIW, Health Inspectorate Wales, and if we've got issues where we think or we can see that there's something not right, we'll ask HIW to go in. And we were picking up about maternity services in Singleton, a lot of issues where they were taking people in to be induced on the wishes of the doctor, and then these ladies were sitting there for 2 weeks, you know, or more, and then being asked themselves, well, you know, if you don't want to be here, man, you can go home, but it's up to you, really, sort of putting the onus back on them. So that was, we reported that back to HIW, and then and other things that we'd heard. HIW did their visit, came out with a lot of actions that needed to be taken up, and that's when the health board said that they would bring in this independent review. So yeah, we'll see what happens now.
Yvonne first, and then you. Okay, Yvonne.
Thanks, Chair. Thanks very much for the presentation. You mentioned about the difficulty with dementia and Alzheimer's in accessing the ethnic minority communities, and I was just wondering, how did you try to access them? What are you hoping? What is it that you need in order to access them, and what difficulties did you have? You know, you asked the question, is it that the families are looking after them, or they don't know? So yeah, I'll stop there. If you could answer any of those.
Okay, thanks. Yeah, We accessed, we did a bit of work in November for Black History Month, and we invited communities in. We held an event in the Grand Theatre where variety, people came in, and we were telling them then about the work that we were doing. We're very lucky to have
Hold on a minute, Sue.
it's gone off.
Okay, go on.
We're very lucky to have a member of staff who is a big part of the Black community in Swansea. She has done a lot of work for us and a lot of preparation, getting us to meet different people, go into different groups. So we took our, Miranda took our engagement officer to these groups to talk to people. But no one wanted to, there was never any feedback on dementia. We talked about carers, but we couldn't get any information from anyone whether or not they had family members with dementia. So that's why we want to extend it that bit further to see if we can get more feedback. Does that answer your question?
Yeah, but what I would say is that most carers, just not just deaf and don't see themselves as carers. So it's a little bit tricky if you're asking them about being carers, because it's just what you do. But I could give you the name of half a dozen people off the top of my head who has dementia in Swansea and Port Talbot. But a couple of them I know, their children in particular, accept that their parents have dementia, but don't want to talk about it. So, if you have a room full of people and you give all this information, they'll just take it and go away. I don't know. It needs a more personal touch, and unless you could come up with a couple of people, a couple of ethnic minorities, whatever ethnicity, that had a good thing to say about the service they receive, that would go a long way. But I could also come up with half a dozen people who don't feel the service they have meet their needs. Not that the service isn't good, it doesn't meet their needs. And so what you still find is that word of mouth, we will say, you don't want to bother with them because you're not going to get what you want.
And I think that's what we
I'm going to leave it there.
That's what we found. Talking in groups, we didn't get the feedback, and that's why we want to delve into it deeper to see if we can get more feedback and spend more fit time. So I'm going to look to you to maybe get in touch with you later on when we're looking to do this bit of work, and you can help me.
Yeah, I'd be
lovely.
Happy to.
Thank you.
Chair, can I just add one other thing? I know that Swansea Uni has just done some research on ethnic minority women and childbirth. I can't remember the more technical terms, but that is another issue that a lot of especially Black women feel that the service they have, the way they're treated when they're pregnant, isn't what they expect, isn't what they know other communities have. So that's something else you might want to have a closer look at.
Yeah, that's good to hear, because now, this is what we are looking at now, and I'll see what I can find out from Swansea Uni to see what they've pulled out of there. That's great. Thank you.
Thank you.
Can
Yvonne.
I add to that? I think yes. I think it's a start. There's some stark statistics on that. I think Black women are 5 times more likely to die in childbirth than white women. So it's definitely something that needs addressing. I'm sure it's similar on a local level.
I'm sure Yvonne will get in touch with Sue and maybe have a further conversation. Yes. Dave,
love
you have
to
a
hear.
question. Thank you, Yvonne. Dave.
Yeah, sorry, Chair. I shouldn't be chipping in and asking questions, but I was very interested in the presentation. So if you forgive me, so you raised the point about as Slice is developing and the links that it could make with this committee, because this committee, there's considerable crossover between the functions of Slice and what this committee, which is focusing on scrutinising the cabinet members and their and the delivery of social services and social care functions and wider within Swansea Council. So there's obviously a link with or potential link that we could make. So the kind of couple of things. Is there anything from your early work that you would flag to the committee around? Well, this is an area that we're starting to hear about, that the committee might want to take an interest in, and that we would all be mindful of. Might not have emerged yet because it's such early days, but that would be one of the obvious things to try and do, make those links. So if you are identifying possible issues, possible themes, I'm sure the committee would be interested in hearing about it, to pick up potential areas for their work programme going on. The chair's has already referenced that these committees are recorded and then made public. So it might be that either your volunteers or somebody within the team might want to keep a weather eye on what's the committee looking at, because that might be, again, intelligence. So you get a two-way link there, which I think could strengthen that. So it's kind of that as a starting point. That would be a good way of making links. If you were happy to feed through to either via Rachel or direct to the committee, these are some of the things that are coming up, and to then be monitoring what the committee are looking at, that will help strengthen those links. And then because, again, one of the functions of the committee is to scrutinise the cabinet members predominantly around the performance of the services that they ultimately are responsible for. You've set out some of those requirements around the local authority now is expected to be supporting the development of life. You're given some specific examples. So even if you haven't picked up on any issues yet that you might want to flag to the committee, how are we doing as a council, and particularly that helping strengthen those social care links? Are you happy? You've referenced you've got a go-to person now. That's good to hear. But are you able to give any assurance to the committee today that actually you're okay with how well we're trying to work with you to establish a speed in our responsibility? So even give any early assurance, well, that we are trying, we are engaged, there's work to do, or if you were unhappy with any elements of that, it's absolutely appropriate for you to flag that to the committee as well, to make sure that we are taking responsibility of what our new responsibilities, so to speak. So I think there were a couple of bits in there just to flag, I suppose.
Thank you, Dave. Are there any other questions for Sue?
I'll just go back on. I'll start with the last bit. Yeah, I think we've started to make some good progress in how we work in. We did have to cancel a couple of our workshops, but that was our side. So things have taken longer than we would have hoped. I know it's recorded, but I think Swansea Bay are a lot more easier to work with than other sides. We've really getting people. I could email Rachel and ask her a question, and she comes back with the answer. It's a lot of learning for us. We've done everything in health for so long. We know it like the back of our hands. Social care, wow, it's huge. And I'm talking to the converted, but our advocacy service is are receiving complaints, and some of them are quite, you know, they multi function type complaints. So seems to be a difference in the complaints in that way, whereas with health you'll get complaining about, oh, you know, this didn't go right with my operation or something. But with it seems to be one thing after another with the social care, that they get about 6 things in one. So they find in that they're going to, you know, it's taking longer to work through. But I think, yeah, I think we're beginning to get together. We're getting to know the people we need to talk to. So we're not going round in circles trying to find people. And I think the more we hold our workshops, the more we share in as well of what's going on. We've got the plan, and I think I'm right in saying you come in to discuss the plan to one of our service groups, so that the volunteers get chance to listen to what's happening in social care. We invite health, anything that's sort of topical, we try to invite. We brought in orthopedics because after COVID, the waiting list was just absolutely, you know, off the scale. And we did a big report on orthopedics then, but we had consultants coming in as well and talking to us, which really helps. You know, it makes the volunteers feel that they're doing something right and they're getting involved in something, which is what we want, because they're the ones that are, you know, our eyes and our ears as well.
Thank you, Sue. Are there any other questions? Tony?
Sorry, Chair, this is an afterthought as we've been talking. And I asked this question because I'm a governor of a school, primary school in Swansea, in Town Hill. And partly because of COVID and partly because of other reasons, the increase in the number of young children with additional learning needs is quite significant. Has that crossed your doorstep in terms of the additional waiting time for assessment that has caused, to the extent that the children, by the time that they've been assessed, are already in secondary school? And I know it's a resource issue, but it's also a moral issue in my view. So I just mentioned that to see if it's already on your agenda in some way, and if you've been able to make some preliminary plans as to how we go about dealing with it.
It has, and that was one of the main reasons for doing children and young people mental health. And I've got one of the team actually, we've sort of put it to September time to work on this, because we've got the maternity to, which is a biggie to work through now, but she's already started collating information, and yeah, so yeah, definitely we're hearing it. We're also hearing a lot about ADHD medications that you know, families can't get them. So that's something we've put through a representation on that already. So we're waiting on a response on that. But yeah, there's so many children come out of COVID with and they're on a waiting list, aren't they, for everything.
Thank you. Any other questions? Thank you, Sue. I thought it was really important that you came, because people don't know the Community Health Council is closed and that it's now Llais. The general public need raising awareness of it, and so hopefully we will be able to promote it a little bit more, and maybe you get some volunteers. So thank you, Sue.
Thank you, Sue, and you can come back anytime.
Thank you. Feel free if you want to go. Item 7, update on the Council's policy commitment translate to adult services. Louise, you wanted?
Yeah.
Yeah.
Yeah, great. Thank you. So yes, this is our annual update on how our council policy commitments are faring. Hopefully there is nothing new to you in the report, because I think we've regularly brought these issues to scrutiny as we've gone through the past year. But just to pick out a few points as we go through, there's a section on local area coordination. I'll hand over to Hayley to jump in on that bit. So in terms of the sort of general policy commitments of investing in better care, clearly every day we're striving to do the best we can to deliver our adult services vision of working alongside you to live well and safely in our community. We are prioritising prevention, early help, reablement, and making best use of resources, whether that's delivering our services in-house or through our commission services and working with partners. Regarding our commitments for fairer pay, clearly, the cost of living crisis is difficult. We've had to kind of factor that into our agreements to make sure that our real living wage is delivered, both with the workers that we pay and those that we commission. Better day opportunities and respite. We recognise how important these services are for individuals and for their carers. We're making sure that they deliver the best outcome for people and also matching that with the best use of resources. And we're about to undergo a look specifically at our day services and how that kind of looks going forward. Lax, I'll bring Hayley in for that if it's at the end. Is that okay? Yeah. Have I gone too far? No. Review of post-pandemic care provision. It does seem like a long time ago now, but I think we're definitely still feeling its effects. We've learned from COVID and tried to keep some of the good stuff in terms of the ways of working, but it's definitely forced us to adapt and deal with much more complex demands coming in at our front door and how we respond to that. For example, we've previously reported recently that we've just finished the restructuring of the assessment and care management function. So hopefully that should streamline and make much more effective our front door and how people progress through that assessment, that really important early stage and how their care is then managed. There's a lot more detail in there, but I won't read it. Looking at increasing our council direct delivery of care, I think again, as we've previously reported, we're really looking to focus on the more specialist services, things like the Home First pathway. We've heard about the fantastic results we get with reablement at Bonamine House. Our specialist dementia care unit in Tîm Wynarloedd is up and running and very successful. So again, looking at how we can make best use of our resources, how we can work with partners and do as much as we can where we know we can make a difference. And then finally, engaging with health. Clearly, we do this on a day-to-day basis. Our integrated head of service, Helen, is between us and the health board. And then a lot of other areas with teams of that common working with the equipment store, community mental health, and then obviously working with the RPB on a more strategic level. So that's a quick run through. As I said, hopefully nothing on there is new because we've talked about it as the year has gone on. So it's a bit of a summary really. And Hayley, if you'd like to pop in on your bits.
Yeah, thanks, Louise. Yeah, just to touch on local area coordination, obviously it was a policy commitment and we managed to achieve that full coverage. It hasn't come without its challenges, particularly this financial year with, pressures, which I think everyone is feeling. So whilst we are still committed, it has had to change the landscape across Swansea, with the teams having to reach a bit further or increase their population size, which we're at the early stages of, so we can't really kind of indicate how that's going to go at the moment. But I think we all recognise the positive impact that our local area coordinators are making across the city for our residents, with our residents, particularly in that the way that they work is very person-centred, strength-based. So it's having such positive impacts. Yeah, and it would be remiss of me not to mention that they won an award recently, and well, very well deserved actually in the Equalities, Inclusion and Cohesion category in the Wales inaugural Safer Communities Award. And I'd just like to applaud the team for their efforts in that as well.
Thank you, Hayley.
I just finally say I was just asking Amy, I wasn't sure if I was allowed to say or not, but we did have CIW in last week to, assessing our adult services, and the report isn't in yet, but we had a really good feedback session at the end of the week, which was really positive. Brought up the things that we knew were our strengths in terms of co-production and prevention, and what was the other one? Communication and and working and be able lots and lots of strengths, and the areas that which we know are challenging, as we've discussed before, in terms of the financial situation and our waiting lists and all that kind of thing. So that we'll bring the report once we've got it back to scrutiny, but it was a really nice boost to end the week, I think, on Friday. So
Thank you, Louise. Amy, do you want to add anything?
No, well, I could say no, and then I'm going to say something. Sorry. Sorry. No, what I was going to say is just in terms of context of this, the policy commitments as they stood just at the very beginning of the report, we say that they've been subsumed now into the steps within the corporate plans. The corporate plan of 2023 to 2028, these are incorporated now. So again, in terms of future reporting, I'm not sure whether we report in that way, but this was just to sort of summarise where we are at this point in time with these.
Thank you, Amy. Do you want to add anything, Dave? No. Are there any questions? Paxton, you've got a question.
Thank you, Chairman. Just a quick one, really, in terms of local area coordination. Obviously, we discussed it when we were talking about the budget because of the changes that are coming there and the reduction in the number of area of LACs are going to be. Obviously, the area mainly affected, as I understand it, is the Gower area, and certainly from my point of view, in terms of Fairwood Ward and particularly Three Crosses, I have got no idea what cover I have now in respect of local area coordination. I'm just wondering when I'm going to hear something.
Paxton, you and I definitely had an email from our local area coordinators. I'm not saying it's Hayley's area than mine, but I know that Sarah, that John emailed you, me, and Jeff and Mary to say that Sarah was continuing as our LAC.
Yes, certainly. Obviously, Sarah is, but when I talk about Three Crosses, she doesn't cover Three Crosses. She'll cover Upper Calais, but not Three Crosses. And I'm not sure what's happening in the west of Gower as well in that respect. So I think we really do need to know as soon as possible what the situation is there in that respect.
Yeah, sorry, Paxton. I did speak to the team last week or the week before, and I was of the understanding that all councillors were going to be contacted by either their current LAC to say that there was no changes, or by their new LAC, and that the council website was being updated to ensure that the areas, the geographical areas, were changed so that you would know who your local area coordinator is.
Can I just add? Oh, I'm sorry. Can I just come in, Councillor, just to let you know, the website has been updated, particularly in terms of Gower, Pencloud and Three Crosses. It's Zara. We'll email the details after the meeting as well.
Lovely, thank you, Amy.
Okay, fine. Sorry, can I just say thank you for that? But I have not heard anything in terms of an email or any contact in that respect, so I would appreciate it.
Okay, Paxton. Mark, you've got a question?
Yeah, thanks, Chair. First of all, I want to say the LAC is a fantastic facility, and I do make the most of it. I've got two areas to cover, Llangefelac and Velindre. Velindre is adequately covered with Joseph. But Llangefelac, I am struggling for coverage. We did have Sarah Dawkins with us for a while, and she was fabulous. She was covering maternity leave, but she's moved on elsewhere, I think, due to funding shortages. So I'm struggling possibly for another month, just over a month and a half, without an LAC as I see it. I just wonder if you had a sort of reserve LAC I could call upon. Thank you.
Yeah, it's a good question, thank you. And as you might be aware, Beth's due to return from the 1st of June, so she will be back covering the area.
Oh, right.
In terms of the short term, we've got Claire and Claire Sorry, I can't remember her surname. Sorry, Claire McCarthy. Claire McCarthy Reid and Ronan Ruddy, they both are the assistant managers and they can be contacted with anything. Again, we'll share the contact details outside of the meeting. They don't, we don't have a sort of floating area coordinator. I think a lot of the strength in area coordination is about knowing those local areas and that work in that way. So it's a model. It doesn't necessarily translate to them mobilising someone across the county, but certainly Claire and Ronan should be able to link in and advise. And I will, double check with the team if there's any other plans in this month, because you're right, Sarah, really pleased Sarah did the temporary cover, but she has returned to a substantive job as well.
Smashing.
Thank you.
Thank you for the advice. Thank you.
Thank you. Yvonne, your hand is still up, or is it, do you want a question now, or is it an old hand? She's gone, is she? Yvonne? I assume it's a historic hand. Are there any other questions? Tony?
Yes, thank you, Chair. I've been musing as we've had the earlier presentation, and the thought that's gone through my mind is that I think a couple of meetings ago we did have a fairly quick debate about the availability and the utility of network theory. And it seems to me that the presentation from the colleagues from the Health Authority and social services that we've heard about is an example of how network theory can be used in part to bring together different bits of the machine at different times. And I wondered if we've made any progress with colleagues, particularly in the universities and elsewhere, who have been able to create networks for a particular purpose, and bring that to the front in terms of armamentorium, etc.
Any of you got to answer that?
We do have good networks. Yeah, we do have good networks. I was going to say, I'm not sure we've looked at it on a theoretical basis in terms of actual network theory, in terms of sort of social science network theory with the universities. But certainly looking at something like area coordination, a lot of that is the principles of making those connections locally and within organisations, third sector, public sector and private sector. Also, a lot of our work we do with the health board is around that partnership and our third sector partners. So there's a lot of progress there. So it's a huge amount of our work, as the councillors have said as well. So in terms of the theory side of it, we will follow that up. You did tell us we've had, yeah, we will.
Are there any other questions? No, thank you very much for the presentation, and yeah, thank you very much. Okay, we go on to item 8 now. And that's for the committee. I don't know if you want to go. Yeah. Take care. Okay, item 8 is looking at us as a committee. Some of the questions for the panel. So, have anybody got any comments to make on the committee and how they think we're dealing with it? And yeah, you know, the questions of what went well, what if anything could be done better. Has the panel worked focused on the right issues? And what have we learned that would help us to improve and develop future scrutiny? So have you got any thoughts, anybody? Should we go one at a time then? What went well? Silence. Nothing?
Sue?
Yeah.
Hi, I just wondered if it might be an idea if we had a pre-meeting to discuss the questions. We can agree on the questions that to be asked for the actual meeting. I mean, meet up a quarter an hour, 20 minutes beforehand, and go from there. That might be a way forward. That's the only thing I can suggest, really.
Pre-meetings, yeah, fine.
Pre-meeting, yes.
Yeah. If that's the wish. And again, if there's a subject that any of you think that we should have a discussion on, please, you know, put that forward. Yes, and that's your role as well.
Just to add to that, Sue, I think we're thinking of doing the same thing with Child and Family Services as well.
Yeah.
So certainly market is on our horizons in that sense as the coordinators to do that.
Yeah, I can't think of anything else really.
What do you think? Has the committee worked well this year? Alan?
Yes, Chair. Thank you, Chair. Yeah, apologies for being late. I had 4:30 in my mind to come here, but I made it about 10 minutes late. Yeah, just looking at point 3 on there, has the panel's work focus on the right things? I suppose that they have in a way, but I find there's always a distinct absence referring to sort of homelessness, alcohol and drug addiction. And I see that mental health has been discussed, or a place, shall we say, a point of contact for those who have left prison and maybe asylum seekers. I'm looking at the title, Adult Services. I mean, these are adults. I mean, we don't seem to refer to them in any way whatsoever. And I mean, it is a concern within the city centre. We do complain about the fact that there's antisocial behaviour allied to a lot of these who are deemed to be homeless and suffer from alcohol and drug abuse. I mean, shouldn't we sort of include that as part of our remit? Because, I mean, the situation is getting worse in the city centre, and I think we need to do something as a committee or as a panel to try and address the situation.
Yeah.
I mean, I have mentioned it in the past, and it seems to have been sidelined in the sense that it should be in some other domain. I don't know which domain that should be, but it's just something that I feel that we should be addressing, but it never seems to be discussed at any point.
Okay.
Yeah.
Chair, can I just say, we have actually just not long ago completed a scrutiny inquiry on antisocial behaviour. So we will have covered some sort of aspects from that. That was quite a sort of big piece of work. And then the report went to Cabinet and was recommended lots of recommendations, and we've had sort of feedback on that. So there is, that covers some of it. But in terms of, I'm just wondering if you sort of wanted to bring an item to the panel, what would you want a briefing on? You know what I mean, for them to be able to write something, because that's a big area to include all those sorts of, or is it that you'd like them to look at these sort of aspects of the things that they already bring to the panel? Do you know what I mean, to sort of try and cover?
Yeah, I've read the document regarding antisocial behaviour, but that it seemed to primarily focus on young adults.
Right.
So we say those who are currently in school or perhaps recently left school. Okay. I mean, that's it seemed to be targeted on there, but I'm thinking of those who have, like I mentioned, who may have left prison and are left to their own devices, and I feel, and they quickly then return back into the addiction they were put in the prison in the first place for. And but how to address it, you're asking me? What?
Yeah.
And
I'm just wondering what they'd bring a report on, for somebody to put it together.
Well, it would probably how are we going to address or help these people to overcome their addiction, or to try and address it in some way. I mean, I gave an example of a drop-in centre that used to be at the Brunswick Church prior to the pandemic.
All right.
Where I mean, they could go there for something to eat, somebody to speak to, a bit of medical care, and they felt as though somebody was trying to do something with them. I mean, it didn't work in all cases, but just on one or two, we did sort of, they did recover, but there doesn't seem to be anything like that at the moment. And I know that there's something happening up in Penlan, which is called Ogof y Dylam, which is a kind of centre a drop-in centre that accepts these kinds of
so maybe the provision for helping the homeless and those that are leaving prison.
And I know that the person who is managing that, which is Hugh Davis, and he was hoping to try and set up or to re-establish the centre in the Brunswick Church, where it would be a kind of rehabilitation centre. And I know he's presented that somewhere to council. I think to the councillors in the Castle Ward, but it doesn't seem to be getting anywhere with it. You know, there's somebody there who's
He's an
willing to
officer
try
for
and
the
do
council,
something,
is he? He's
but
an
there's-
officer that's in the council.
Pardon?
He's an officer that's in the council.
No,
Right. Have we got an officer within the council that would deal with?
I'm not sure.
That type of-
I can make some inquiries and see where this is sort of sits, if it sits as
Yeah.
services, if not, where we should be. If not, if it isn't something that would sort of naturally come under other services, maybe for working groups, because we've got a work planning conference coming up. So I'll do some investigation and sort of come back to you and see.
shall I have a word with Hugh Davis? Yeah, and because he's got a clear plan in his mind that he wanted to develop. Of course, the
yeah, right.
pandemic. Came in.
Who does he work for?
Well, now he's with the Methodist Church.
Right,
So he's based at the moment in the Methodist Church up in Penlan.
right. Well, Liz will make some inquiries and we try and put something on the work plan for next year,
Yeah. It's referred,
addressing some of those issues for people, is it?
it will be referred to as Ogof Dulham at the Penlan Methodist Church.
Maybe you can let Liz have a connection, a phone number.
Yeah, I'll give you Hugh's
Thank you, Alan.
email address.
Okay,
I just feel that it doesn't seem, we complain about it, the behaviour in the city centre, but there's nowhere for these people to go.
That's fair
You know.
comment.
If we had somewhere like a drop-in centre, even if it was for an hour or two a day,
Yeah.
I mean, it can relieve the frustrations that these people have.
Well, to know what is available out there, I think maybe it would be an advantage to us all to know what was available for people, wouldn't it?
Yeah.
Yeah. So thank you, Alan. Tony.
Yeah, it's just a thought, Chair. I mean, the obvious question that comes to my mind is, what do we know as a local authority about the incidence of homelessness, its origins, the extent to which it's imported to Swansea as opposed to being brought, developed in Swansea, the difference between male homelessness and female homelessness, older people's homelessness and young people's homelessness. And around that, if we know the sort of roughly the numbers and the different circumstances of the numbers, what resources, if any, are being put towards those people in terms of maintenance, health, finding jobs, giving them some kind of status in the community and so on. And maybe some of that is available within the local authority, but it's an area that I haven't bothered to look at, but I'll probably go home tonight and have a search and see what it says.
Well, Liz will see if she can get some information for us and put it on the work plan. Chris, Holly, you could.
Thanks, Chair. There's been at least 3 working groups that I know have looked at homelessness and also looked at the housing situation for people who are roofless. So we've had quite a number of working groups looking at it and reported back to Cabinet. So I'm not quite sure what Cabinet have done about it, but we've constantly done that through working parties, and we've also had an inquiry panel about drug abuse, and I think that went to Alison's Cabinet office, if I remember rightly. But I think if you ask Bridge, he will tell you where. If Liz asks Bridge, he'll tell you where all of them went and what happened with his inquiry panels and with the working group. The one thing I think I would like to see us look at in the future is our residential care. Many years ago, we started doing a project on going and looking at how the cost of residential care and how it fits in with the private sector, public sector, and how our domiciliary care actually fitted into that. And I think we, as a authority, domiciliary care and residential care are so important to our population that I think at some stage next year, we need to have a specific scrutiny, well, I don't say panel, but I think we need to look at us as a board. We need to look at adult residential care because of the importance that it has within the authority.
Thank you, Chris. Are there any other suggestions?
Erica.
Way of improvement, I think pre-meeting, who was that? Oh, Erica.
Thank you, Chair.
The hands on these things are very small, so
It's
I don't
not
know.
good. No,
Oh, it's awful.
Sue, I was just thinking as everybody's talking here, we've got a real increase in mental health in our communities. I know, you know, Penlan was just mentioned, and I go up to the Methodist Church quite often to see Hugh and what's going on. What I think's happening is we're not joining up all these different fantastic people trying to make a difference. And when you said about have we got an officer to do that, I think that's what we need, is somebody to be in the communities to gather that information and put it out there. In Blind and Mice, we've just started a wellbeing group, and the amount of mental health issues that are coming up, I don't know where to go with it, really. Yeah, and you know, people are saying, can we have somebody, can we come and talk to somebody? And I haven't got the direction either. So I think, you know, we need to know what services we've got and what we can put in the communities, you know, because a lot of these people, they won't travel to different places for support and help. But that's what I'm finding. So I would like to see somewhere on the agenda about the increase of mental health, the effects of it, and if we as a council can do something in the communities to support and help these people, if that's okay.
Yes, great. Thank you, Erica. Anything else anybody would like to add? Tony, come on.
Well, it just because this is almost the classic example of a situation that's waiting for different network components to kick in.
To get together.
Whether it's the networks that are trying to prevent poor health, take people off from dependency, find homes for people, and so on and so forth. That to me is a classic network design.
I do think our local area coordinators do a lot of that, mind in fairness to them. But it's formalising what is available there, isn't it? You know? And so yes, I thoroughly agree. Because since COVID, I think every part of our population has been affected in such a bad way, from the very small children up to the elderly. Because loneliness to me is massive out there in the community, absolutely massive. So, okay, have we got enough now to write something on this? Anybody need to add anything else? I think Mark's idea of doing pre-meetings is very relevant for some of the topics that we look at. So if any of you would think that is relevant on any of the meetings, please ask, but not for it to be a matter of course that we do it, that we actually are doing it for a reason. Yes? Okay. All right. Okay, I'll close the meeting then. Thank you all very much for attending. And we go forward.
Thank you all.
I do think we need to. So long. So long.
Bye.